Prostate cancer is one of the most common cancers in men. Sometimes treatment can be aggressive, and that could result in long-term side effects. A new technique being used at Munson Medical Center is aiming to change that.
It's new. The results are phenomenal.
Douglas Brown is a radiation oncologist at the Cowell Family Cancer Center in Traverse City. He says a new technique is helping ensure prostate cancer patients have fewer side effects.
Many men, sometimes it's a very early stage cancer that sometimes we don't have to treat, but when we do have to treat it and eliminate it, it requires us to use aggressive therapies, and those aggressive therapies sometimes can have side effects.
The new procedure, called the Space OAR hydrogel system, came to Munson just 6 months ago.
This is a real game changer, I think, for patients. It allows them to have a very high cure rate for their prostate cancer and essentially eliminates one of the most feared toxicities of radiation, and that's injury to their rectum. It's a very nice product that we inject between their prostate and rectum. It physically separates the prostate from the rectum and essentially lowers the dose delivered to the rectum to less than 50%. So those patients benefit greatly from a toxicity standpoint. Essentially none of those patients are developing long-term toxicity to their rectum.
In order to kill off cancer cells in the prostate, many patients require daily radiation treatments for 5 days a week. This needs to go on for about 7 to 8 weeks. So once injected, the specifically formulated hydrogel becomes a protective barrier.
It's literally about a 10-minute procedure. The patient will give them some conscious sedation. We inject about 10 cc's of this liquid, and then this liquid immediately polymerizes into basically a slab of tissue that pushes the prostate away from the rectum. It stays in that space for about 6 months, and then it just reliquefies and disintegrates.
Marvin Hayes was diagnosed with prostate cancer in November. He's 4 weeks into the hydrogel treatments.
I come every day for 5 days a week. Less than 15 minutes, I would think. Yeah, I can't say enough about it because it's awesome. It's just great.
Yeah.
And everybody is so friendly. Yeah.
Hayes says he doesn't have any pain or side effects from the new procedure, and more importantly, he feels fortunate.
Well, I guess I was lucky. We caught it before it got too bad. That's good. My whole family had a history of the same thing. So
normally, patients who receive the hydrogel wait about 1 week and then receive an MRI and CT scan to help their oncologist design the radiation treatment plans. Dr. Brown says the first couple of patients who've received the hydrogel placement at Munson have had no significant radiation side effects. In the studio, I'm Melissa Smith, 7 and 4 News.